This module investigates the unique demands placed on the voice in professional and occupational settings, particularly for individuals whose livelihoods depend on consistent, sustained, high-quality vocal output. These include, but are not limited to, singers, teachers, broadcasters, call center workers, religious leaders, actors, lawyers, public speakers, and coaches. The module provides a comprehensive anatomical, physiological, ergonomic, and psychological exploration of the occupational voice user's challenges. It equips you with preventive, corrective, and rehabilitative strategies to manage high stakes, high stress, and high-frequency vocal usage over time. We will analyze factors such as vocal load and fatigue, acoustic environment, posture, projection techniques, emotional labor, vocal identity, and career-threatening pathologies, offering evidence-based solutions for managing them. The module culminates in a personalized, proactive professional voice care protocol. Key learning objectives. By the end of this module, you should be able to understand the specific demands and stressors placed on the voice by various professions. Identify early warning signs of vocal fatigue and injury. Implement healthy voice use strategies tailored to occupational context. Analyze the role of vocal ergonomics, amplification, posture, and room acoustics. Develop a sustainable vocal care routine for professional settings. Recognize when to refer or seek clinical evaluation. Section 1. Categories of professional voice users. 1.1. Occupational voice classification. Professional voice users are categorized into elite vocal performers, singers, actors, voiceover artists. Professional voice users, teachers, lawyers, preachers, broadcasters. Non-vocal professionals, whose work still requires vocal stamina, e.g., flight attendants, tour guides. Each category has differing intensity, duration, emotional engagement, and vocal projection requirements, leading to variable risks of vocal strain and trauma. Section 2. The physiology of high-demand vocalization. 2.1 Vocal load. Vocal load refers to the total amount and intensity of voice use over time. Factors contributing to vocal load: duration of speaking and singing, loudness and intensity, pitch range, environmental noise requiring projection. 2.2 Fatigue and overuse. Signs of fatigue include hoarseness, reduced vocal range, throat pain or dryness, need to clear throat, loss of vocal control or breathiness. Over time, chronic overload may lead to vocal nodules, hemorrhages, polyps, Reinke's edema, contact ulcers. Section 3. Ergonomics, acoustics, and posture. 3.1 Vocal ergonomics. Vocal ergonomics refers to adapting physical environments and behaviors to reduce voice strain. Key elements: microphone use in teaching or performance settings, amplification tools to prevent unnecessary shouting, environmental acoustics, sound-absorbing materials reduce echo, voice-saving policies, scheduled rest periods, reduced noise. 3.2 Postural alignment. Proper alignment supports optimal breath control and vocal resonance. Principles: neutral spine position, balanced head over shoulders, unlock knees and relax shoulders, avoid slouching, reduces lung capacity and breath support. Section 4. Voice projection versus shouting. 4.1 Mechanics of healthy projection. Projection uses diaphragmatic breathing, open vocal tract, forward resonance, mask resonance, efficient airflow with minimal strain. Shouting, on the other hand, uses high subglottal pressure, tension in neck and throat, risk of vocal fold trauma. 4.2 Techniques for healthy projection. Resonant voice therapy techniques, semi-occluded vocal tract exercises, e.g., straw phonation, warm-up routines before speaking engagements, vocal pacing, adjusting intensity, and taking breaks. Section 5. Emotional labor and vocal identity. Many voice professionals convey emotions, authority, enthusiasm, or empathy through voice. This emotional labor causes involuntary laryngeal tension, especially when emotions are not genuinely felt. Examples: a teacher masking fatigue with excitement, A customer care rep sounding cheerful while stressed. A pastor expressing intensity for extended periods. Implications: increased risk of functional dysphonia. Suppressed emotion causing somatic symptoms. Solutions: psychological support, mindfulness training, voice coaching, and authenticity alignment. Section 6. Self-monitoring and preventive practices. 6.1 Daily voice check-ins track changes in vocal quality. Note onset of hoarseness or fatigue. Observe hydration, sleep, and stress levels. 6.2 Preventive practices. Scheduled vocal rest, avoiding throat clearing and whispering, regular warm-ups and cool-downs, use of steam inhalation and proper hydration, limiting alcohol, caffeine, and smoking. Section 7. Warning signs and when to refer persistent symptoms requiring medical evaluation. Hoarseness lasting over 2 weeks, pain during speaking, sudden loss of voice, frequent vocal fatigue after minimal use, globus sensation, feeling of a lump in the throat. Professionals should consult ENT, otolaryngologist, specializing in voice, speech-language pathologist with voice expertise, vocal coach and therapist for technique refinement. Section 8. Building a voice maintenance plan for professionals. Key elements: pre-performance warm-up, lip trills, humming, scales. Hydration strategy, before, during, after use. Voice journal to track symptoms, usage, triggers. Rest periods and nonverbal communication methods. Emergency protocol for vocal injury days, rescheduling, mic use. Cross-training with singing, breathing, and articulation drills.